In the hospital, a prescriber typically orders a drug by writing instructions on an order sheet in the patient's chart. In some facilities, the prescriber enters the order into a computer. Either way, however, you may find one of several different types of medication orders. They include standard written orders, single orders, stat orders, PRN orders, and verbal orders. This order for 150 milligrams of ranitidine given daily by the oral route is a standard written order. If a standard written order doesn't specify a time period, then it usually remains in effect until it's discontinued. When a drug should be given only once, a prescriber writes what's called a single order. This order is for one 650 milligram dose of acetaminophen given orally. If a patient needs a medication right away for an urgent problem, the prescriber will write a stat order, such as this order, for 1 milligram of lorazepam by the IV route. The term PRN comes from a Latin phrase that means as the occasion arises. Thus, a PRN order allows you to give a medication when the patient needs it. Sometimes a PRN order specifies a reason for giving the drug. For example, this order is for 2 milligrams of morphine sulfate every 4 hours by the IV route as needed, but only for chest pain, not other kinds of pain. A verbal order is one that a prescriber tells you in person or over the phone rather than writing it down.
Could you please give Mr. Parks 20 milligrams of furosemide IV times 1?
All right, Dr. Stevens, that was 20 milligrams, 20 of furosemide IV times 1, correct?
Yes, that's correct. Thank you.
Okay. I'll have Mr. Parks' chart here for you to sign in the morning, okay?
I'll sign it first thing in the morning.
Verbal orders are easier to misinterpret than written orders, so you should avoid them whenever possible. If you must take a verbal order, repeat it clearly back to the prescriber and ask the prescriber to sign your copy as soon as possible. Regardless of the type of medication order a prescriber writes, it must include certain information, including the patient's full name, the date and time, the name of the drug, the form and amount of drug to give, the administration route, the time schedule for administration, and the prescriber's signature. Several types of medication errors can result from the orders themselves. For example, medication errors can result from poor handwriting, incomplete orders, dangerous abbreviations, and misplaced decimal points. Here are some examples. Does this order say to give 5 milligrams of diazepam or 3 milligrams of diazepam? Should this 25 milligrams of meperidine be given orally, intramuscularly, or intravenously? And how often should you give it? Based on this order, should you give 10 or 100 units of subcutaneous insulin before each meal? This order says to give 1.25 milligrams of digoxin each day by the oral route. But is that within the acceptable range? Or did the prescriber really mean 0.125 milligrams? Anytime you think an order is unclear or may be incorrect, it's your duty to clarify the order with the prescriber, a pharmacist, or your supervisor before you give the drug to a patient.
Absolutely.
Okay.